serving IDIKA, the Greek Government Center for Social Security and Health Services, acting as the Greek adoption site for the xShare yellow button. My name is Yannis Polupos. I'm serving IDIKA, the Greek Government Center for Social Security and Health Services, acting as the Greek adoption site for the xShare yellow button. My name is Yannis Polupos. I'm serving IDIKA, the Greek Government Center for Social Security and Health Services, acting as the Greek adoption site for the xShare yellow button. In Greece, we see that the xShare yellow button functionality creates many opportunities. First of all, it empowers patients and enhances data availability because patients are able to access and share their own health data. For example, patient summaries, lab imaging reports, etc. in structured machine-readable EHDS format, underpinning GDPR's data portability. Also, it supports interoperability across systems by fostering cross-border exchange and patient-app interactions, aiding care coordination, telemedicine, and chronic disease management. The xShare yellow button acts as a catalyst for innovation, as there is a great opportunity for startups, EHR vendors, and digital labs to integrate the feature under the xShare label, creating this way a market for interoperable health tools and unlocking research use cases, for example, public health monitoring, through standard compliant data sharing. And finally, it provides alignment with the EHDS and national strategies by aligning with Greece's trajectory toward digital health modernization, transformation, and supports wider EU ambitions under the European health data space. Following the xShare reference guidelines in the governmental and legal domain, we mapped out Greece's authentication mechanism and we are progressing with the required compliance with GDPR and EHDS legal prerequisites. Regarding the technical domain, we integrated the EHRF expert functionality by creating a middle layer on our infrastructure, which acts as a connector between the national contact point for health and the citizens' mobile app. Also, we conducted extensive successful testing using the proof of concept mobile app developed in the context of the xShare project by adhering to the specifications and being compliant to the requirements, which will be integrated into the national e-health record system later. The yellow button will be integrated to the national e-health record system, providing to the authenticated user the functionality to select datasets like patient summary, lab results, and others, and export them to EHRF structured health data files. Healthcare providers will be able to import the EHRF data file, improving transfer of structural clinical information without any manual data re-entry. The patient will be responsible for sharing their data, having the xShare yellow button act as a consent solution for the near future, as in Greece currently the patient consent is being only implicitly given when visiting the healthcare provider. The yellow button supports Article 20 of GDPR by enabling patients to obtain and transmit their own health data in a structured, widely usable format. EHDS requirements are met also for patient access and personal data exchange via standard formats, ensuring Greece is prepared for national and cross-border health record sharing. The next steps will be, first of all, to integrate it into the national health record system, to have the label certification in place to be able to engage health record vendors, and to provide national training for clinicians, IT staff, and citizens. The barriers we foresee are, first of all, the legal provisions that should be in place to be able to start operation in production environment, and as we all know, this is one of criterion. Adapting additional clinical documents to the EHDS format will be also very interesting, and dissemination and communication of the service to increase citizens' awareness and gain their trust in using it. summary, implementing the xShare yellow button in Greece offers a clear opportunity to place patients at the center of data-driven care, fulfill GDPR and EHDS commitments, and spark digital health innovation. Achieving full-scale deployment will require technical upgrades, user education, clear governance models, and integration into national health systems. But the path aligns well with the EU health data ambitions and Greek healthcare transformation.